Patients and families, caregivers, need to trust that they're receiving good quality care. They need to know that they're putting their loved one into a place that they can relax. It's very important to me that a patient's family feels comfortable, that they can go home to their own bed at night, that they can sleep in their own bed, that they feel comfortable, that they can call and get a good answer as to how's my mom, how's my dad doing. The patient needs to trust that they're getting quality care, because if they don't, they're not going to get better. We want to make possibly the worst experience of their life as comfortable and as easy as possible. It's not going to be perfect, but they need to be able to take a deep breath and focus on getting better.
Nexus is a place where the patient comes first. You can walk into this building and feel the energy, feel the care, the compassion.
Technology is very necessary, but if you do not have a caring facility, a caring staff with compassion, you don't have anything.
Nexus Specialty Hospital has two campuses in Shenandoah and in the Woodlands, Texas. The Shenandoah location is a 54-bed adult specialty hospital with a 6-bed ICU, step-down telemetry unit, and medical surgical unit. There they focus on really stabilizing a patient that may be taking a longer time to recover than a traditional acute care hospital is able to provide. That's really the main focus of that campus, is medical stability and really starting rehab as soon as possible. Hopefully, patients are then able to transfer to our Woodlands campus of Nexus Specialty Hospital, which is a 21-bed campus, and there the rehab program is really able to begin. We're hoping they're able to take advantage of several hours of therapy and that they're able to participate in groups. They have a specialized neurotherapy team there to take care of those patients, and they also house a life care program there.
We are able to deliver all these levels of care within the same framework, following that patient from an acute level of the ICU throughout the continuum. A patient does not have to leave at every step of the way to find another placement and reacclimate to that. The case managers are able to work seamlessly with our case managers and provide that success, that progress for that patient to facilitate their recovery.
You can look at the numbers, you can look at our outcomes. We are benchmarked against some of the best LTACs in the country.
One of the things that I'm most proud about in terms of our clinical leaders is their ability to sit down and critically think through a difficult patient situation. If we have a concern about our patient, it's not uncommon for the director of rehab, the director of respiratory care, our chief clinical officer. It's not uncommon for all of those people to be sitting down at the table and trying to figure out how to do the best thing for this patient at this particular point in time. It's not that they're in an office somewhere with the door closed and completely removed. They're still in it. They're still bedside. They're still, holding that patient's hand and telling them what they can do. If I am in a situation where I have to bring a family member, these are the people who I trust to take care of my family member. If that wasn't the case, I couldn't do what I do.